it's all right. It's all right. Anna, thank you so much. First of all, let me just say to everybody, thank you for being here this afternoon, this late evening here in Tampa. Really appreciate it. Anna is amazing. She's an amazing member of Congress. We work incredibly hard together on Capitol Hill, fighting for this country, doing what is necessary for the Republic. So please give her a round of applause. She is. We have a couple of elected officials in the room with us. We have Representative Karen Gonzalez-Pittman is with us. Karen, it's good to see you. Where's Adam Ross? Where is he? Hey, how you doing, man? How you doing? Listen, first of all, we have the chairman of the Pinellas County Republican Executive Committee here with us. Thank you so much for being here. You good? Absolutely. You look like you're in a comfy chair. Actually, yeah. I think I got the best chair in the room. How are you?
I'm good. How are you?
This is the head of the Hillsborough County Republican Executive Committee. It is great to see you. Thanks for being here with us. So, first of all, Florida is a tremendous state. We are in great position. We are the best state in America. It is not close. The other 49 wish to be us, and they can't. And I'm just here to tell you right now, as the state's next governor, they're not going to be able to catch us anytime soon. We are going to keep Florida as number one. And the reason why we're going to do that is a couple of things. First of all, Governor DeSantis has done a tremendous job as our governor. He's put us in great position. Before him, Governor Scott also did a tremendous job. We've been on a little bit of a hot streak in our state, and this has been wonderful, but we got to keep the momentum going. And how we keep the momentum going is that we have to be focused on all the key aspects of Florida's government. We have to drive efficiency. We have to make sure we're driving outcomes. And part of that is insurance and healthcare. And so I want to talk about it a little bit today, but also open it up to the floor. I want to hear from you about the things that you're thinking about, the things that you're considering. What are your concerns? What are your ideas? What are your plans? Because the future of our state is a future that we build together as Floridians. The future of our state is one where we maintain the conservative foundation that has made us the envy of the other 49 states. But we also have to plan for the future. I know people are concerned about future growth and what's this going to look like long term in our state. But I'm here to tell you, if we don't plan for the future, that's the number one way, all the momentum that we've seen, we're going to say resting. They don't maintain success resting on their laurels. They maintain success by rethinking some of the things they thought they knew, keeping the strong foundations that brought them to where they are, and having concrete strategies in every aspect of what they do to be better tomorrow than they are today. And I want to be clear, it is not a statement against anybody serving our state today. It's actually an acknowledgement of their success and their victories, because they've placed us in this position right now where we really have the blessings to think about the future of our state, as opposed to having to unwind so much. Look at Virginia, look at New York, look at California, look at Illinois. Those states are awful. They have a ton of work to do if they ever want to catch us. So we're in a blessed position. And my mission as being Florida's next governor is to build on the foundations that have made us great and to take us to a whole nother level. So with that, I want to talk a little bit about insurance, a little bit about healthcare, and we'll open up the floor. In insurance today, this gets to be like nighttime. It's like a nighttime event. You get to have like a real intimate time together. I'm excited for that. So in insurance today, we're doing actually pretty well. The insurance market, property and casualty, has stabilized. That has stabilized. The auto insurance rates are actually coming down. We switched it. There we go. Mic 1, mic 2. Seamless, easy. Here we go. The insurance market has stabilized. Property and casualty insurance rates have stabilized. The Office of Insurance Regulation in Florida reported out, I think about two or three months ago, that none of the insurance companies in our state have requested a rate increase. We haven't seen that in Florida. Geez, I don't know how long, 5, 6 years we haven't seen anything like that. That's great news. But we still have more work to do. We're going to keep the reforms that Governor DeSantis and the legislature put into place several years ago. We're going to keep those reforms because those reforms are what's driving down the loss ratios in our insurance market. So those need to remain in place. But what else are we going to consider doing? We're having conversations right now looking at the catastrophe fund, looking at the various retention levels in Florida. Is there a better way, a more modern way, where we can make adjustments to make it even cheaper to insure in Florida? Some of the other good news, and I'm going to explain a little bit about property and casualty insurance. Every insurance company that operates, not just here in Florida, but in the world, they have this thing called reinsurance. They actually insure half of their book of business gets insured by another company. In the private markets right now in reinsurance, their rates are actually quite low. So what we're anticipating in Florida is we're actually going to see further rate reductions this year. Another thing that happened, obviously, last year in 2025, no hurricanes, no major storms. And when's the last time that's happened in Florida? That's just a blessing and a half right there. We've seen no major storms. So what we want to do is be able to take advantage of that. It is going to be important to re-examine everything about Florida's regulatory insurance market so that we can sit there and say, are we pulling every lever possible to drive cheaper prices for the people of Florida, while also making sure we're not opening up a moral hazard. Because the last thing we want is to open up a moral hazard that leaves you, and quite frankly, me and my family as well, on the hook. We don't want to do that. So those are some of the things that we're going to examine. On healthcare, we want to have a full review of how we deliver healthcare in the state of Florida. As a Republican, the thing that has frustrated me more than anything else is the polling that says that the people trust Democrats when it comes to healthcare. But what we've seen from the Democrats are higher prices, more frustration, less doctors, less nurses, the costs are through the roof, deductibles are out of control, it's not sustainable. And here's the other thing, the thing that really keeps me up at night. This is the one thing I want to say that really keeps me up at night. In Washington, the Congressional Budget Office is saying that the national debt is probably going to increase to around anywhere from $53 to $58 trillion over the next decade. What that means is that interest on the debt will be more than any other line item in the federal budget, more than the Department of War, more than Social Security, more than Medicare. When this happens, the federal government is going to start looking at their budgets. And they're going to say, man, we're not going to cut care, but we're going to push a lot of these costs down to the state. That's my concern. So state government has a responsibility to be lean and efficient in how we're going to deliver care. Florida is going to lead the way on this. We are going to examine how we do Medicaid in our state. We're going to find more efficiencies in our program. And we're going to have some serious conversations about healthcare overall and health insurance in our state. And I also think there are best practices with other Republican states, the states that actually mirror our way of thinking about government policy and regulation. I think there's some opportunities there where we can get some broad-based agreements with other states. But this is how we plan and prepare for the future. This is the beginning of it. And so I'm very excited about this campaign for governor. But it's not just about the campaign itself. It's about setting Florida up for future success. Last thing I'll say, and then we'll open up the floor. I moved here at 17 years old. I'm 47 years old now. I don't know if you can tell, I'm picking up grades. My barber he gives me a haircut. He gave me one this morning, and he always tells me, he goes, you got more grades than that beard of yours. I've been in Florida for 30 years. Everything I have in my life has been built in this state. My wife is from Tampa. She was a Chamberlain chief. I don't know what they call Chamberlain today. I think we need an executive order to change the name back to the Chiefs. That would be better. He likes that. But my wife went to Chamberlain High School. We met at Florida State. We now live in Naples. Everything that I've built in my life has been built in Florida. So when I'm 77 years old, 30 years into the future, when I'm sitting at my house down in Naples, I'm long gone from politics. Somebody else is running for governor or is governor. I want to sit back at my fire pit at 77, 30 years into the future, where some of these young guys are now running the place. And I just want to have a cigar, sit back and say, man, we are still the best state in America. That's why I'm running to be your governor now. I want to thank you all for being here, and whatever questions you have, I'd love to answer.
Thank you, Representative. My name is Ron Ogden. I'm a citizen from Donalds County. Something that I don't think too many young people are thinking about right now is here. Some things that I never thought about in my almost 74 years has happened to me in the past 8 months. And my wife of 54 years at this minute is in a nursing home in Tampa, living the last few weeks of her life with a victim of Alzheimer's. Representative, I want to know what is the state of Florida, the home of all, the vast majority of elderly people here in this part of the world. What can we do more to address the medical needs, the social needs, the emotional needs of the elderly? All those people who for 50 years never thought what would happen to them and now find themselves in such a situation.
Well, first of all, I'm really sorry to hear about your wife. I really am. How long have you been married?
54 years.
54 years. My wife and I are about to celebrate 23 years of marriage in a couple of weeks. And I know what she means to me in my life. And you've been married 54. You have been through it all. The ups and downs, the successes, the failures, the joy and the sadness. And you guys have done that together. So first of all, I'm really sorry to hear this about your wife. I think to the core of your question about what can we do, in Florida, we've been trying to find ways to provide more access and more care for the elderly. But I firmly believe what needs to happen now is we have to leverage the information and the technology in our state, especially when it comes to healthcare. We need to be far more efficient in delivering real choices and real interventions at key times. That's critically important. If something as simple as preventative care has to wait because you can't find a doctor, you can't get in to see a specialist, all that does is leave the human body open to potential deterioration because you're not getting that care that you need at that specific point in time. The other thing that we want to do is we want to drive far better health outcomes, not just using the old healthcare system way it's always been, where it's fee for service and it's test after test after test. We want to be focused on wellness on the front end. What are we consuming when it comes to food? And I do want to give credit where credit is due to First Lady Casey DeSantis, because her initiative, actually testing food, is critical so people know what they're actually ingesting into their body. But on the back end, in the years of life where you engage healthcare more, when you're dealing with doctors more, we want them to be equipped with all the information at real time so that you're not getting delays in test results. You're getting quicker diagnoses. You're getting more effective diagnoses. And I think that actually really helps quality of life, not just when you're young and you're ripping and running, you're building families and building careers and building businesses, but in your golden years, when you're trying to actually take a breath and enjoy the life that you built with the woman that you love. I think that's critical. So when it comes to healthcare, especially for the elderly, these are the things that we're looking at. We want quicker responses, more accurate diagnosis. We want real interventions to be able to help people either get the medicines that they need. We want to examine and find ways to push down the cost of prescription drugs even further, looking at real efficiencies in the health insurance space so that it's not driving money out of your pocket and putting stresses on you when you're trying to figure out how to get not just the care you need, but also maybe some of the prescription drugs that you need as well. I think in healthcare overall, we have to, in my opinion, rethink the delivery system. Historically in our country, we have been funding hospital infrastructure, and it's driven up the costs. We have to be brutally efficient when it comes to healthcare, because this is not about money, it's not about cost, it's about human lives, and it's about the quality of life and being able to enjoy those years with your loved ones until that time does come when they leave this earth and they will see their Maker. Thank you, sir. And my prayers go out to you and your family as well.
Hey, Congressman, how you doing? Good to see you.
Good to see you.
So, I'm sure you may know over 5 million Floridians currently rely on Medicaid.
Yes.
And I serve on the board for Tampa General Hospital's county board, and we saw their books, and they did over $80 million in charity for indigent care services, et cetera. Right? And a lot of that is when you look at Medicaid, the full dollar is not reimbursed on Medicaid. And so it makes it unattractive for a lot of providers and healthcare providers taking those patients. How would you address making Medicaid more attractive for healthcare providers, A, and B, what is your stance on Medicaid expansion?
Let me take the expansion first, and I'll come back to how to make it more attractive for providers to actually want to deal with Medicaid populations. In Florida, we are not going to expand Medicaid. And let me explain why. Medicaid expansion under Obamacare will create a major fiscal burden for the state of Florida that we're not going to be able to pay for long term. Current Medicaid expansion calls for 100% payment, 90% payment for able-bodied adults between the ages of 18 and 54. Able-bodied adults, 18 to 54, they are covered 90% by the federal government, 10% by the state of Florida. Now you would say, well, Byron, that sounds like a pretty good deal. Except what we've already seen in other states is that when they've expanded Medicaid, you actually get a flood of able-bodied adults out of the private health insurance market and into Medicaid. The state budgets drive up dramatically. Actually, to the previous question, what are you going to do about the elderly or people who are young with major acute issues or pregnant women who don't have the resources and they're looking for help and they're on Medicaid, or seniors who are indigent, and what do you do about that? It actually crowds them out when you expand Medicaid. So Florida's not going to go down that road that too many other states did. And look, and talk to my colleagues when we were going through the president's agenda. One of the big things that they were having problems with was how to dig themselves out of Medicaid expansion. It was a bad deal when it was proposed 15 years ago. It's an even worse deal today. Florida's not going to go down that road. But when it comes to Medicaid overall, this is where I think true efficiencies and modernizations and how quickly we can pay providers makes it more attractive, making sure that we're not paying for out-of-state populations. Let's be clear on something. If somebody's here in Florida and they're on Medicaid and they leave our state, and they sign up for Medicaid in another state, if Florida doesn't catch it, we still pay for that here in Florida. We got to clean that piece up. That's not going to be the standard going forward in our state. We are going to take care of Floridians. We are going to make sure if you're poor and you need that assistance, we're going to be here for you. But we are not going to take on the additional burden of able-bodied adults. We're not going to do that. And it's not right to those populations who are truly in need and truly need care when they need it. And for the doctors and the nurses in the offices that struggle with dealing with Medicaid, from the government side, we're going to give prompt answers. Instead of having to wait 60, 90, 120 days, it should be 30 days or less. Past just talking about Medicaid or healthcare overall, as a government, and we have the best government in the country, let's be clear, but as a government, we want to be ruthlessly efficient in every aspect of government. Florida's government has to be just as responsive as Florida's businesses. If you deal with any business owner and they say, oh, we'll get back to you in 120 days, what do you do in your own life? You go find another business to talk to. But because government has you as a captive audience, because there's no other government to go to, You have to wait on us. To me, that's disrespectful of the people of Florida. And we have the technology today where we can speed that up, and we're gonna speed that up. And I believe if you have a much more efficient system in processing when it comes to Medicaid, where we're not throwing money out the door, we're gonna do all the eligibility checks, all the fraud checks, people who are on Medicaid, who do qualify to be on Medicaid, eligible to be on Medicaid, we will be there to provide that help. But we're gonna be efficient about it. We're not gonna have everybody drag their feet through red tape and frustration. Because all that does to a doctor's office, all it does, it makes them have to hire more people to be able to make sure that the stuff's getting processed so they can get paid for an exam or whatever they were doing that they did 4 to 6 months ago. That's not how this needs to work. That's not how it's gonna work going forward. All right, Representative, I'm gonna call on you.
Congressman, that's a very good answer about, wanting to be more efficient. And I think what most people don't understand about Medicaid, speaking as the spouse of a physician and friends of many physicians, is Medicaid it's not that they don't pay well, they don't pay. We have taken in Medicaid patients. They don't pay, it's zero. So I think that would lend itself to access to care if Medicaid and the managed care would start paying physicians. That's why they don't want to take Medicaid. It's not that they don't want to take that population. Then if you were getting paid, you would have a number of physicians sign up and take those patients. But if you're doing work and it's not even 120 days, you're not getting paid. It's none.
Well, let me be clear. I don't know about any of you, but if I'm doing work for a company and they say, hey, we'll pay you in 4 to 6 months or not at all, yeah, I'm not interested. And nobody would be. That's not even common sense. So like I said, we have a lot of reforms and modernizations that need to occur in all aspects of Florida's government. Healthcare and Medicaid is going to be a major part of this. And, for a lot of the bureaucrats in our state, this is the way we're going. You either get on board or there's the door. Because we don't work for bureaucrats. They work for us. And that's the way this is going to go. Yes, sir.
Thank you so much for being here, spending time with us this afternoon. My question is related to the youth mental health crisis. Outside of the traditional provider mindset as a potential solution, I'd be curious to know any ideas or thoughts you have about the topic.
My thoughts overall is that we have a major mental health crisis overall. Before I come back to juveniles, the biggest issue we have in mental health in our state is that a lot of our mental health issues reside in our county jails. And they sit there, and then you have the county jails who are going to try to figure out how they're going to manage a mental health case versus managing the criminals that our sheriffs have a responsibility to arrest and keep our citizens safe. So Florida is going to have to completely re-examine mental health top to bottom. It is people in their county jails. It's, frankly, our first responders who are going in and out of calls every single day. And the stuff they see would blow your mind. And they're having to forget it all and then go to the next call and then be professional every single time. But it's also with our young people. Like, I firmly believe that in part, social media is causing a real problem for young people because they are seeing on their screens what they think life should be like, as opposed to, in reality, knowing what life is. And I think that's part of it. I think the legislature tried to address this a couple of years ago. I'm very glad that they did. And look, I don't play politics. I'll mention it. This is one of the things that Speaker Renner, when he was Speaker, he addressed with Governor DeSantis, and he's to be commended for addressing it. I think if you're going to talk about young people overall, and this is not a burden we can place on schools, because educators have enough that they have to manage. They also can't be mental health counselors as well. I think in Florida, we do have to increase funding in mental health. I also think that we should examine reopening some of the old state facilities with respect to mental health, because you have to provide a place where people can go and actually get the care they need with professionals who are steeped in providing that care, not just leaving it to the whim of the Baker Act, or leaving it to the whim of the county jail system, or frankly, leaving it to families that have to try to manage this on a case in case out basis. And look, family members always are trying to protect their family members. So it's hard for them to try to figure out how to get the help that they need. They're trying to find a way to do it internally. And I think that we have to rethink that and be very robust in how we're going to deliver that for young people in our state, but people overall in our state. I'm gonna go that way, but that's all I had said earlier. I'm gonna come back this way. Yes, sir.
You mentioned property insurance. I realize property rates are coming down. So I guess the question is, what's causing my property insurance rates to come down? And more importantly, how do we keep that momentum and trajectory going in the right direction?
Great question. The number one thing that's pushed that down has been tort reform. Tort reform in our state is working. The loss ratio with these insurance companies is coming down. The governor made an announcement, I believe it was 6 weeks ago or so, about Citizens Insurance. Citizens announced, I think it was like an 8 to 10% rate reduction in Citizens policies. That's a wonderful thing. The only way they were able to do that is because the litigation costs are down because of tort reform that happened a couple of years ago in the legislature. So those reforms that were put in place by Governor DeSantis, those reforms are going to remain. They are going to remain in place because, look, we're having success right now. The actuaries in the insurance companies, they need 5 years in order to do a full look back on what the true cost is to rate risk in Florida. So I personally believe we keep the plan in place, keep the reforms in place. Let's get to year 4 and year 5. We're around year 3-ish right now. Get to year 4, year 5, and that actually would demonstrate a real, I think, a real view of what the risks are to insure in Florida. And we have to get to that point. So we're going to keep the reforms in place. I'm looking forward to doing that. And like I said earlier, then examining some other aspects of Florida's regulatory environment around insurance to find ways that we can decrease costs even more. Yes, sir. And I'm going to come back this way. I saw your hand.
Some years ago, I might have been the commission said, if a company wants to come in Florida to insure, it cannot just come in on the field, they have to be homeowners. And I don't think anything ever happened with that, and that's why we have limited choices on our homeowners. And so these companies never come in, just do automobile, and that's it. And they had no obligations, so I don't know what's happened with that. And the second thing that I have on is there like a possibility, maybe it's something exists, that there would be a slush fund for the insurance companies so that if a big storm comes in, they can obtain some funds while lowering our rates over a long period.
Are you asking if it's possible, or is that something?
Is it possible? Is it something?
It is possible. I think the thing, if you go down that line, I'm trying to figure out if when storms come in, there's some sort of pressure release valve to try to keep rates low overall. The number one thing around a strategy like that is you don't want to create a moral hazard where the state is now holding the risk. Because here's how the state insurance framework works under the Florida Catastrophe Fund, the CAT Fund, if anybody's ever heard about it. If the losses in Florida go over $17 billion, every insurance policy in our state can be assessed. Renter's insurance, E&O insurance, auto insurance, other property and casualty insurance, it all can be assessed. And we don't want to be in a situation where we create a moral hazard where the insurance companies basically are just offloading the risk to you and me. That we don't want. I think there could be an environment where you are designing a way to have a pressure release valve where in any event rates go really, really high, you can find a way to stabilize the market in a temporary time. I think there's some prudence to that, but the number one thing above all of it, you don't want to create a moral hazard. Look, if a company knows they can offload their risk, that's what they're going to do, right? And I just want to make sure that Florida and Floridians are not having to carry the weight while a bunch of insurance companies are getting rich. We're just not going to design a system like that. I think to the earlier question about a carrier having to come in and write home and auto, or they can't write at all, I don't think we need to be that prescriptive. to be blunt with you. I don't think we have to go that far. The reason why people choose to do business in Florida is because we're a common sense, pretty low regulation environment. And we don't want to be too cute by half and start doing things that might solve a problem today or sound good today, but you're not creating a consistent regulatory framework into the future. And I think what we need to be doing as a state going forward, laying out the new foundations for the future of our state, being consistent about how they're applied, so business owners and people can come in, make decisions, yes or no, and let the markets largely operate. Thank you, sir.
Hi, Congressman. Thank you so much for being with us today. My question is with the rise of anti-Semitism on college campuses, how do you, as a future Florida governor, plan on ensuring that college campuses remain safe for all students?
This is a great question. Anti-Semitism and any other form of bigotry or racism are simply not going to be tolerated. They're not going to be tolerated. Listen, I think some people will say, Byron, where are you on the First Amendment? I'm a First Amendment absolutist. I truly believe that government officials have a responsibility to protect free speech. If somebody wants to be ignorant, they have the First Amendment right to be ignorant. If they want to be a clown, they got a First Amendment right to be a clown too. But what we're not going to do is allow for Jewish students or Black students or Cuban students or white students to be victimized and to be disrupted from being able to go to class, learn, earn skills, and build for their future. So those are the things we're not going to tolerate. The second you decide you're going to impede somebody else, the state of Florida is going to step in and say, absolutely not. You're not going to create a chilling effect on these institutions that try to create a bigger burden on somebody to be able to find a way to live their dreams and to access their dreams in Florida. And I think that is a common sense standard to have. I think, forget government for a moment. Let's put government aside. Let's talk political leadership. Political leaders have a responsibility to establish moral clarity on this issue. I've never been big into the disavow this person, disavow that person. I'm not a disavow person. I don't do that. My stance is, if you're a clown, I'm gonna call you a clown. And it's gonna be clear to everybody else. If you're a bigot, that's who you are. And it's gonna be clear to everybody else. And I think that it's important to understand that there is a moral clarity. There is a peaceful order in a free society like Florida, like America. But we are always going to stand against anti-Semitism and every other form of bigotry. It's simply not right. It's not just. And let me also be clear about this one. A lot of these people who are running their mouths online, social media, they would never do it to your face. They like to be tough when they're sitting on their phone or when they're sitting on their keyboard. But they wouldn't come in and do that in public. And I think that we have to assert some moral order and some moral clarity. And that still respects First Amendment rights when people decide that they want to be clowns, or they want to be ignorant, or in the current environment on social media where they're trying to get likes and they're trying to get follows so they can go try to monetize whatever they're trying to do. We're not going to tolerate that in Florida. We're simply not. This is a great question. I thank you for asking. When I talk about building for the next generation of Florida's growth, infrastructure is critical for that. One of the reasons why I think that we have to streamline governmental operations, and it's also matters in building homes, building commercial centers, is because you have to have streamlined permitting and planning in these regions of our state so that the counties have a sound strategy of what roads need to build, what improvements need to be put in, where the state plays with local government in order to make sure that's accomplished, so you can actually have more efficient transportation networks. As I travel the state, one of the things that I hear is that it's actually quite rare for local government officials across jurisdictional lines to actually sit down and talk about these things. They typically don't talk about what road do you think is more important. And so I think it's going to be the responsibility of the governor's office to be working with each region of the state. The Tampa Bay region, we're here right now, actually working with the local elected officials in the Tampa Bay region so we can have a concrete idea of how we're going to permit homes and businesses as we move forward in our state, and have that be efficient to lower the cost of housing and lower the cost of building commercial centers so people can afford our state more into the future. And if by doing that, the byproduct is when you know what needs to be built, now you know what roads also have to be built as well. I met with a road contractor, and he was telling me about a new interchange he was trying to put in off the turnpike. He could have designed it, him and his company, in 8 months. They could have done the design work in 8 months, started construction, and probably built out the new thing over about high side, early a year and a half. If you have delays and stuff like that, 2 years. One of the government agencies, I'm not going to reveal it, I'm going to be kind, but one of the government agencies said, well, we do our own design work. All right, well, how long is that going to take? 3 years. 3 years of design work, 2 years of construction. You're talking about 5 years. 5 years. And what's going to happen over the next 5 years in our state? More people are going to come to Florida. So I think efficiency is what's necessary now going forward. I commend the governor for actually opening up his moving Florida forward plan where he was taking some dollars to expedite key projects. I think that's important. What I would bring to the mix is regional planning in every part of our state. So we actually have a growth plan that is consistent for each region of Florida. We can account for the new homes, the new businesses, whatever the case might be. And then, because you're doing that, planning out future road construction and driving efficiencies in the planning process so you can get that done. Nobody wants to sit in traffic. I don't like it. I'm an excellent driver. I really am. I'm an excellent driver. If you need to get somewhere, just give me the keys and we're gonna get there, all right? I get frustrated too, like everybody else. And so what we have to do is really plan and build in an expedited manner to address that, to address those growth concerns. I think one of the bigger concerns around growth in our state that people are frustrated with is that we grew very, very fast over the last 6 years. Very fast. It was unexpected, but it happened, and that's really to the credit of Governor DeSantis. Now, he led the state during COVID. People said, enough of this craziness, I'm getting to Florida. That's what happened. But in response to that, we now have to build out the infrastructure very quickly to meet that demand. And that demand is not stopping. You got Mamdani in New York talking about raising property taxes because he can't get raises in income taxes. Well, guess what? You're going to have more people saying, like, man, I knew this dude was crazy. I got to get out. So we have to be efficient with people's time. We have to move very quickly through the permitting process. And let's be clear. The things that we're permitting, especially when it comes to roads, we know the designs. We know them. The designs are not too dissimilar from what we've already built in Florida, except the new bow tie deals they're building at a lot of the interchanges. But the designs are not too dissimilar. We know what needs to be done. We have to just be efficient in delivering that quickly so we can address your needs. And your needs are not just yours. Everybody in Florida is talking about it. Here in Tampa Bay, down in Miami, Palm Beach and Broward, up in Jacksonville area, we don't even want to talk about I-4. We don't even want to talk about that. And in other places as well. We can deliver it, we can do it, but I think it's about being a far more efficient government and how we get these jobs up and running. Yes, sir.
Well, I'm a physician here, so I don't know but doctors in the Bay Area. Sure. I moved up to Tampa 2 years ago. I have there's at least paperwork and scout work on doctors. And burnout is one thing, but this actually is very frustrating. Dealing with the regulations, dealing with the insurances, who want to deny care, who want to prior authorizations, who want to do this and do that. I usually finish work at 3 o'clock. I don't go home until 5, just sitting and going through this paperwork. Is there anything that you as a governor in the future are going to do to make our life easier and the patient's life easier? Because these 2 hours, I could have seen more patients. I could have provided health care to them, but I could not because I'm doing the paperwork.
No, I think there's definitely work that we can do. And it speaks to the same thing you've been dealing with his question about transportation. It's about modernizing these internal operations. And it's going to be a top to bottom effort. This is not something that we're just going to put on local government. State government's doing it too. Let me give you an example. Half of the state's operating systems, not half, maybe 30%. Some of them still run on DOS-PROM. We have old, I'm not joking, we have old legacy systems in state government that have not changed in a very long time. And I think for Governor DeSantis and Governor Scott, this is not their fault. They have made strides in trying to modernize the information systems of the state of Florida. And what this means for you in your business, in your practice, is that if we modernize our side of the game, then we can speed up, cut down on paperwork, you have more efficient ways to communicate with us, we can get the data flowing, you get quicker responses, and then you have time to see more patients. The technology wasn't, in my opinion, ready for the level of efficiency that healthcare in particular needs. The technology is ready today, and it's actually getting better month by month. I know there's many conversations about AI. All over the country, everybody's talking about it. But here's the truth. If you want to deliver quicker health outcomes, if you want to take the burden off of our doctors and our nurses, the people who are going to do this work, then yeah, we're going to have to use AI in part, not in total, to speed up the administrative side of the house. You were trained to help people live healthy lives. You were not trained to fill out paperwork. That's just the way it is. And so government has a responsibility now to move at the speed of business. And as Florida's next governor, one of our core missions is to make Florida's government move at the speed of business. Yes, ma'am. And I will come to you.
That's okay, I have a couple of questions. Number one, the movie industry was gonna come here to Florida. It went away because Florida legislators didn't want to give them any opportunities or cuts or whatever, so they went to Georgia and South Carolina instead. I mean, just from watching what happened over at the Clearwater Marina when they did that movie about the dolphin, it brought in millions of people here. What are we gonna do with that industry? Are we gonna tap into them? Second question has to do with the same type of thing.
Sure.
Technology left Florida. A lot of technology left Florida and went over to the other countries. Since now we've got all these tariffs, we've got the chance to bring technology back here, manufacturing, research, and everything else. What are you going to do to help those areas? I mean, those areas all bring in people, but they also bring in higher educated people, which would help Florida get to where you want to be.
All right, so let me talk film and I'm gonna come to tech. Here's where we are today in film. And by the way, when we got rid of the film credits, I was in the legislature. So I was a member of the House when that was removed.
I know.
And it went to Georgia, you are correct. Well, they've left Georgia now. What's happened now is that the Europeans are the ones who provide all the credits. So that's why when you like watch your movies and stuff that stream, it seems it's all being shot in Europe because it's all being shot in Europe. This is larger than just Florida itself. It's all across the country. And so this is something I know that the White House is having some conversations about. So on that front, I will stay tuned. I will say stay tuned, but I want to be clear on this. In our state, we have really chosen not to go down a broad-based incentives route. And what Hollywood wanted was broad-based incentives for them to come and shoot. And they just hop from place to place because they can march and shoot wherever they want to. And now they're doing it in some parts of Asia, mostly Europe, and that's where they're doing most of their shooting right now. So it's much bigger than Florida right now. Two, tech. Yeah, we have to embrace tech in a major way. And I think that's part of Florida's future. The three-legged stool of Florida's economy has always been agriculture, construction, and healthcare, or tourism. I mean, what I'm saying, tourism, healthcare.
Right.
That's been the three stools. We need to add technology as a fourth leg of that stool. And I also say we need to add finance as the fifth leg of that stool. This is about expanding Florida's economy, expanding the pie. So people who are already here, young people in college and trying to get out of college and find a great paying job, people trying to live the American dream here in Florida, that they have the economic opportunities. Kennedy Space Center over in Cape Canaveral, they did 165 launches last year. They're slated in about 5 years to do 400 launches. Because they're doing so many launches here in Florida, and the reason why we have a geographic advantage is because we can access both poles of the earth here in Florida. What that does, it gives us an opportunity to attract tech back into Florida. I actually think that you go north of Cape Canaveral, south of Jacksonville, I'm starting to call it Silicon Beach. We don't have valleys in California, so you gotta dance on what you got. But I think we can do that here. I think there's a real opportunity to have a real tech hub in Florida. And I know that conservatives, we're concerned about big tech. We have been for a long time. We remember the COVID years. I think Florida should lead on tech. We should lead. It should be our viewpoints on government and governance. It should be our value systems that actually guide tech, into the future. Because if we don't step into that space and guide tech into the future, whether you're talking AI, tech writ large, or anything else, it's gonna be the Democratic left. And we already know what that looks like. So that's my view. I do want to embrace technology here in Florida. I think we can do it, and it's not according to your question, but a part of that is finance. Finance is coming to our state. They're also going to Texas because New York and Illinois have blown it. They're really dumb. They don't know what they're doing. So we have a real opportunity to take advantage of that and build an even more vibrant and dynamic economy in our state while still protecting what we love about Florida. So these young kids over here can build their dream in Florida. You already had a question, man. I gotta go in the back. Yes, sir.
Thanks for being here. Of course. Steve Harrison, David Jones. Quick thank you, and I have a question. The thank you is we really appreciate the role you've taken in the hospital issue in Congress, or up in Washington, I should say right now. I will spare the audience the complexities of that financial arrangement. I just want to say we really appreciate that.
Of course.
The question is really something that Congress has been looking at the last 2 years, much more than it has previously. It's something called the pharmacy benefit managers, or the PBMs, and what role PBM has in the healthcare continuum, the healthcare costs as they're increasing, and I just wondered at a high level, what your thoughts are on PBMs. Is there something that Florida can do towards the PBMs?
Well, my general thought is I think PBMs, when they were originally created, there was a reason. And I think that was mostly because you had a dislocation in information. The information lines weren't really clear between pharmaceutical companies, obviously hospitals, physicians, etc. That simply doesn't really exist anymore. And so while I think there was a time where PBMs were critical to how we were going to dispense drugs and find savings for individuals, I think that time probably is passing us. So we need to look at real reforms. I know on Capitol Hill, we're trying to find ways to reform PBMs, and that's not done. And look, let's be clear about this. A lot of these PBMs, they have walked their ways into a very profitable industry. And now they kind of don't want to let it go. That's just the truth. We're going to have to reform that entire situation. We have to be based upon sound information in real time and price transparency and in driving efficiency for people, for the end user. The people have to pay for this stuff because it can't be this opaque black box run by any three-letter acronym that nobody really knows what it means except PBM or whatever that, or ACA or whatever we want to call it. It can't be that. It has to be real transparency. It has to be an open system where people can see the real costs and take advantage of them. This is why President Trump has been pushing so hard on most favored nation status, and I agree with him. Because with where we are in the world today, why are we subsidizing the pharmaceutical costs for every other country in the world? Why are we doing that? And so these are the reforms that we have to do. The PBM space is going to be a part of that. Hi, it is good to see you. I remember Lisa. I didn't want to put your name out there, but I remember.
I'm a property insurance law, that's why I just want to do that. I want to tell you and compliment you, the president drove the rural health transformation program. You're probably familiar with it. Billions of dollars are going to come into Florida. We have 32 fiscally constrained counties. I do a lot in Panhandle, I'm on the Appalachian Regional Planning Council, appointed by the governor. I don't know if anybody's briefed you about that, but it is truly going to transform. I know our hospitals here are hearing a lot about it, about how we put these billions of dollars into our rural health care. And I'm so pleased to hear you talk about wanting to entice more people to help our rural get better health outcomes. Have you been briefed about that, or have you watched that closely? What's your comments about it?
Lisa briefed on it. I was there in the room when it got kind of crafted. So yeah, I'm aware. We were excited about it when we were going through the president's agenda last year, that if we were going to make some adjustments to Medicaid, and we did as part of the DPP stuff that we're having to deal with here in Florida, one of the key things we wanted to do was try to actually provide real dollars to things that matter, and rural healthcare was a part of that. So we're very excited about it. I know the governor is beginning to look at that and trying to deploy how some of those resources are going to be utilized in our state. We want to follow up on that and make sure that's being delivered. Actually, had a conversation about rural healthcare yesterday. One of the things that we want to make sure is understood is that if we want to really think outside the box, in some respects, rural healthcare has to kind of resemble the concierge model per se, but it has to really kind of, what was old is kind of new again. It needs to be in-home visits. We are going directly to the people who need it. I mean, why would you build an emergency center? I'm not saying you don't need one. Why would you build an emergency center in the middle of a 40 square mile rural area? Who's driving to the thing? Better to actually invert the system and have the providers go see the people who need that care in real time. And we believe that those dollars will help to facilitate that and actually help build out the internal infrastructure needed so you can have a stabilized rural health care system and network. So I'm excited about what's about to come. Yes, sir.
Yeah, hi, Congressman. Thanks for coming to Tampa Bay.
It's always my pleasure to be here.
My name is Mike Van Zickler. I'm Times, and I was wondering.
Oh, you can't answer. You can't answer. I'm playing. Go ahead.
If you become governor, you're going to have tremendous oversight of higher education. And you mentioned earlier that you want to be brutally efficient with costs. So how would you apply that approach to higher education? Under the last few years, we've seen a plethora of lawmakers becoming presidents, making a lot of money. Recently, we've just heard about the Attorney General making $100,000 for teaching one class. What would your approach be to compensation like that? Is that something that you would change? Is that appropriate? What would this approach be?
Well, first, specific to the Attorney General, I'm not sure what that agreement is with the University of Florida. I think that's something that he's speaking to now, so I'm going to let them deal with that. I think if anything, it kind of does highlight something probably about, well, let's just call it what it is, about what's happening with the AG of the third largest state in America, kind of needing a second job. So I think that's probably something the legislature and the governor need to try to figure out. We'll see where they go. I think if you're talking about efficiencies overall with the university system, like I said, it's going to be everywhere. I think the efficiency standpoints of the university system are slightly different. If you take, and not just the universities, but if you take the pre-K through 20 system, we need to make sure that our young people have the skill sets they need to be economically successful the second they cross the stage when they graduate high school. And what I mean by that is Our standards in Florida need to be about young kids mastering math, reading, and writing when they graduate high school. We also need to help them identify what their natural strengths are in life. Maybe your natural strengths do not take you to the university system. Maybe they just take you to the college system. Or maybe they just take you to an apprenticeship and directly into the workforce. What I've seen as I've traveled the state, a lot of our business owners, they didn't graduate college. They either went directly into the workforce or they dropped out and followed their passions. And we need to help our young people understand what their strengths and their passions are and help them be on a pathway to economic success, whether that's direct to the workforce, whether it's the college system or the university system. At the university level, what I think we need to start looking at is the economic viability of some of these degrees. I majored in finance. My wife majored in accounting. Let me just be clear. Our degrees gave us more skills that made us economically desirable and successful in the marketplace than a journalism degree. That's not, oh, no offense to you. I didn't mean to say that to you. I didn't mean to say that to you. I'm so sorry. Oops. I didn't mean to do that to you. But let's just we have to be honest with our young people. Here's what the different degrees typically yield in terms of annual salary, if that's what you choose to do. Don't hide that information from them. Tell them that on the front end so they go in eyes wide open, knowing what they're getting into. I think that's very important for the future of our state. I don't want to see young people burdened with student loan debt and then try to figure out how come they can't get the job they thought they were going to get because they were looking on social media and Instagram and they see how somebody else lives and they're not living that life, and then they have real frustrations. So the efficiency is not just the university system, it's the entire education system. We want to put kids on a pathway to success. Every child in our state. Right now we do IEPs in education. And those are for children with special needs and children who have fallen behind. I think every child in our state should have an individual learning plan. Every child should have one of those. So you can actually help not just the child, but help their parents understand what's the trajectory for my son or for my daughter, and how are we helping them be prepared for life and be successful. I think that's the true thing we need to be doing in education, and the university system is a part of that. When people are kind of in that last rung, trying to figure out their degrees and what they're going to major in, what they think they're going to set their lives up to be. So I think that in education, we fund it, and it's great, and I love funding it. We're going to continue to fund it. But we fund it not just to say we did it, and it gives somebody a degree or a piece of paper that doesn't help them be successful in life. We fund it because we want young people to be able to take the reins of leadership in our state, and frankly, in our country. Whether that's career, a small business, a family, politics, or whatever the case might be. And I think that's the trajectory of education that we need to go down. And we're really excited to, try to break some new ground and make that a reality. So I've been given the hook. So I'm gonna do one last question. I will be quicker than this. By the way, I'm not knocking journalism degrees. It was an example.
If you don't mind, Congressman, I'm yielding my question to Rico.
You got two? All
So,
right, go ahead.
Congressman, this question is not from myself, it's from a supporter of yours who couldn't be here this evening, but I wanted to ask, they have concerns with the negative impact that government-led price controls could have on our healthcare system. Do you think MFN, most favored nation, will hurt America's leadership in finding new treatment and cures?
Actually, I don't. I've been having some conversations with the leaders of some of the country's pharmaceutical companies and some of them around the world. And I think what you're actually going to see with most favored nation, you're going to have a stabilizing cost, a true appreciation of the cost of medicine and the cost of R&D into the future, as opposed to what we now have is the United States and our people are subsidizing that cost for everybody else. And so I think actually having consistency and transparency will still be able to yield enough enough, frankly, income for these companies to continue to invest in R&D. I also think the R&D side of the ledger is changing. This is also where technology is coming into place. Pharmaceutical companies are starting to really invest in technology to help squeeze the timeline in R&D to be able to go through clinical trials, deal with the FDA, and go to market. So I think in corporate America, whether you're a pharmaceutical company or any other company, they're all trying to find ways to drive efficiency to lower costs. Because I think if you talk to any corporation or any business, they all know there is an upper limit to how much they can charge. There's an upper limit. In economics, I mean, not all prices are elastic. There is a point where you just can't raise them anymore because people just won't accept it, or they'll make other choices. And that's actually the beauty of a dynamic free market system. I would say in pharmaceuticals, if you take it from a global perspective, we've not had a dynamic free market system. We've had a system of heavy subsidization, most of it coming from the United States, being put on the backs of the American people. And most favored nation breaks that.
Thank you.
Thank you, everybody. I really appreciate it.